Hello and welcome to the Oxygen Administration and Therapy topic. By the end of this session, you should be able to understand the indications of oxygen administration and therapy, define the terms related to oxygen administration, recall normal and target values, assess patients who may need oxygen administration, and finally, recognize the different methods of oxygen administration and therapy. Let's get started. The goal of oxygen delivery is to maintain targeted SpO2 levels in patients through the provision of supplemental oxygen in a safe and effective way. This is done to relieve hypoxemia and maintain adequate oxygenation of tissues and vital organs. It is also to give oxygen therapy in a way which prevents excessive carbon dioxide accumulation. Oxygen therapy also assists in reducing the breathing work. Now, what are the indications of oxygen administration? Well, it can be divided into acute and chronic conditions. As for chronic conditions, some patients may require oxygen therapy, and conditions include chronic obstructive pulmonary disease, cystic fibrosis, pulmonary fibrosis, and sarcoidosis. However, in acute conditions, there are some medical emergencies that require high concentrations of oxygen, such as in shock, sepsis, major trauma, cardiac arrest enduring resuscitation, anaphylaxis, carbon monoxide and cyanide poisoning, asthma exacerbation, acute heart failure, pulmonary embolism, and transfusion-related acute lung injury or TRALI. Let's look at the contraindications to oxygen administration, and they include paraquat poisoning and carbon dioxide narcosis. Paraquat is a common herbicide and is toxic to humans, and poisoning by this substance is worsened by oxygen therapy due to its redox activity. However, for carbon dioxide narcosis, it occurs in patients with conditions such as obstructive pulmonary disorders or chronic respiratory insufficiency that result in hypercarbia. So, over-administration of oxygen may reduce the respiratory drive. This reduction can result in further hypercarbia, altered mental status, or even complete respiratory collapse. Now, let's define the terms. It's important to define the common terms used in this skill. So, FiO2 stands for fraction of inspired oxygen. PaCO2 stands for the partial pressure of carbon dioxide in arterial blood. It is used to assess the adequacy of ventilation. PaO2, or the partial pressure of oxygen in arterial blood, is used to assess the adequacy of oxygenation. SaO2 is the arterial oxygen saturation measured from blood specimens. SpO2 is the arterial oxygen saturation measured via pulse oximetry. Hypercapnia is increased amount of carbon dioxide in the blood. Hypoxemia refers to the low arterial oxygen tension in the blood. And finally, hypoxia is the low oxygen levels at the tissues. The following are the normal values for arterial oxygen saturations among others. So SpO2 level being 92% and above. Partial pressure of arterial oxygen, which is ranging between 80 to 100 millimeters mercury for children or adults, and 50 to 80 millimeters mercury for neonates. Partial pressure of arterial carbon dioxide, ranging between 35 to 45 millimeters mercury for children or adults, and pH being 7.35 to 7.45. It is important to determine if the patient requires oxygen administration. Therefore, it is essential to perform a thorough assessment which includes heart and respiratory rate measurements, observing for signs of respiratory distress, measurement of oxygen saturation using a pulse oximeter, and arterial blood gas sampling. There are various methods that can be used for low-flow administration. These include nasal cannula, which is a thin tube used to deliver oxygen directly to the nostrils from a source connected with a tubing. This is the most common method of delivery, providing flow rates of 2 to 6 liters per minute comfortably. and this allows the delivery of oxygen while maintaining the patient's ability to utilize his or her mouth to talk and eat. Next, we look at face masks. So face masks can be generally divided into simple face masks, air entrainment masks, and non-rebreather masks. A simple face mask is a mask with no bag attached, which delivers oxygen at 5 to 8 liters per minute. An air entrainment, or also known as venturi mask, can provide a preset oxygen to the patient using jet mixing. As the percent of inspired oxygen increases using such a mask, the air to oxygen ratio decreases, causing maximum concentration of oxygen provided by an air entrainment mask to be around 40%. Finally, non-rebreathing mask, which has a bag attached to the mask known as a reservoir bag, which inhalation draws from to fill the mask through a one-way valve and features spots at each side of exhalation, resulting in an ability to provide the patient with 100% oxygen at a higher liter per flow rate. Now, finally, let's have a look at the methods of high-flow oxygen administration. So this can include a high-flow nasal cannula, or HFNC. It's a nasal cannula which is with the capability of humidifying oxygen and capable of flow rates that exceed the inspiratory pressure of the patient. This setup allows delivery of 100% FiO2 while maintaining the patient's ability to utilize the mouth to talk and eat. HFNC may also be used to lengthen times of apnea in preparation for intubation. Next would be continuous positive airway pressure, or CPAP, and bilevel positive airway pressure, or BiPAP. Continuous positive airway pressure, or CPAP, is a mask that delivers continuous positive pressure to the patient. Similarly, bilevel positive airway pressure, or BiPAP, is also positive pressure delivered via a mask but has an inhale and exhale pressure set at differing levels. Bag valve mask devices are masks operated by hand for resuscitation when patients cannot breathe on their own and can connect to oxygen sources for increased levels of oxygen delivery. Ventilators are machines that breathe for patients, either through a tracheostomy or endotracheal tube. So the ventilator can have oxygen delivery titrated to specific patient needs and delivered through positive pressure. Lastly, neonatal incubators. So neonatal incubators provide oxygen supplementation, and they do so by increasing the concentration of oxygen in the interior chamber without directly applying oxygen to the patient. We have finally come to the end of this lesson. Thank you for your time.